Um, Thank you very much. And when we are speaking about cancer and treatment of cancer, we know that one of the big problems is the suffering from side effects. The other problem is that the new treatments, immunotreatment, are meeting an hostile environment. So let's go back to the basic. What is the difference between a normal cell and a cancer cell? Well, we all know about it because when you go and you make a PET scan, what is happening is that you are being given radioactive glucose, and the scanning is just looking where it concentrates. Where it concentrates, these are cancer cells. So what is happening? What is the difference really between these cells? So 100 years ago, it was already discovered by Warburg. It's called the Warburg effect. So what is happening is that in normal cell, this mitochondria, this small organelle inside the cell, has a pore. From this pore, the energy is going out, but not only the energy, but also the signal for programmed cell death, because a cell should not reproduce more than a few times. What is happening in cancer? Well, the cell is being asked to reproduce and to divide and divide and divide again. For this, it needs a lot of energy. And there is a new enzyme which is coming in the game. And this enzyme is very big. It's a big protein. And it blocks this pore. When it blocks it, it blocks also the signal for programmed death. So cells are dividing and dividing and dividing. But not only that, is that because it is doing its job as a glycolysis, just using the sugar, there is an environment which is very acid, which is created around the tumor. And then the immunological system doesn't work well in this environment. So it's tens of years that people are looking, oh, are we going to stop this enzyme? Well, it doesn't succeed because the active site of this enzyme is the same as any one of the glycolytic enzyme. We say we came with a completely different idea. We say, let us protect the active site and let us just displace this big enzyme from the pore, creating new molecules using both normal and artificial intelligence, just to make a little bit of change here, so that it cannot block the pore like a cork will block a bottle. And bingo, this was it. And then we got a few molecules extremely active against cancer. And not only are they very active against cancer, but because they stop this hyperglycolysis, they also stop the microenvironment which is hostile to immunotherapy. So our products are complementary to any one of these new treatments which exist. And bingo again, because this is a pan-cancer system. You see, all cancer cells have this problem of this big enzyme blocking the mitochondria. And each point here under the green light are primary tumors which are sensitive to our product. And these are all kinds of cancer. So, and we are in clinical stage. We are already after a phase 2, and look at the market that we are looking at. In the oncodermatology, we have about a $7 billion market already. And if we go for our new product, which is going for solid tumor, it's huge. It's hundreds of billions of dollars. So this is where we are. And all right. So just to give you an idea of the acquisition which took place in the last 3 to 4 months, they are all in the $1 billion area. And we cannot do that without a team, of course. And our team have been working together, not in this venture, but also on other ventures. And we have 150 years of experience, of which I contribute a little bit more than the others. And so our ask is a $5 million bridge in order to advance to 2 inflection points. First in human with our new molecule for solid tumors, and end of phase 2 for or oncodermatology molecules. And we have 7 patent families which are granted, and composition of matter, chemical synthesis, and so on, up to 2045. So that's it. Thank you very much. I will be very glad to explain more in the breakout room when the session is finished.